Hi, my name's Jay, and I'll be your nurse today. Can I go ahead and get you to state your name and date of birth? Okay, great. I'm just going to confirm that with your armband. All right, Mr. Patient, do you know if you have any allergies? No? Okay, yes, your armband confirms that you do not have any allergies. Earlier, we asked you what your pain scale was on a level of 1 to 10. You said it was a 7. Okay, and then that was 30 minutes ago. We gave you some pain medicine, and what is it right now on a scale of 1 to 10? A 2? Okay, well today we're going to go ahead and do a wound wound care. I'm going to I'm going to remove the previous bandage, clean the wound, and apply a new bandage. Before I start this procedure, I'm going to go ahead and provide us some privacy. I'm going to wash my hands. Alright, now I'm going to go ahead and gather my supplies. I'm going to raise the bed to a working height, and I'm going to lower my side rail. Now I'm going to go ahead and take a look at your wound. I'm going to don clean gloves before I do this. Okay, I'm just going to drape you to provide some privacy, preserve your modesty here. Alright, I'm going to go ahead and remove the wound, okay? Remove the bandage, pulling from out to in towards the wound. Okay. Drainage on the wound on the bandage is scant, it's serous sanguinous, and it has no odor. I'm going to go ahead and get rid of this. Okay, I'm going to go ahead and pull the packing out. Okay, at this point I'm going to go ahead and set up my sterile field. Okay, I'm going to go ahead and remove a few things that I won't be needing today. And now I'm going to pour sterile water into my reservoir without splashing. Okay, now I would date, time, and initial this bottle of sterile water. Okay, now I'm going to go ahead and measure your wound. Before I do this, I'm going to put on sterile gloves. Okay, I've already removed my clean gloves and I've washed my hands.
We got started late. Yeah, we come in, we had to fix everything up. So we just need to stop, come back later.
Is he just started?
He's about to clean the wound right now. I mean, you just tell me what to do, man.
Keep on for right now.
Okay.
Put his
At this point, I'm going to go ahead and measure my wound. And dip the cotton tipped applicator in the sterile water. Okay, without touching the wound. Okay, this is roughly 12 centimeters. Okay, in length, 4 centimeters in width, and 2 centimeters in depth. I'm going to get rid of that cotton tipped applicator. Now I'm going to go ahead and clean the wound. I'm going to moisten my sterile gauze. I'm going to clean from least contaminated to most. I'm going to clean the inside of the wound. I'm going to get rid of that sterile gauze. I'm going to get another sterile gauze. Moisten, wring it out, clean the outer side. Throw away that gauze. I'm going to grab another gauze. Wring it out after I moisten it and wipe the side closest to me. Now I'm going to go ahead and pack the wound. I'm going to start with another 4x4 sterile. I'm going to fluff it and moisten it and wring it out. And with a sterile cotton tipped applicator, moisten that, and I'm going to loosely pack the wound. Without touching the wound with my sterile gloves, I'm going to pack with the cotton tipped applicator. Okay, I'm going to get rid of that. Use one more sterile gauze to pack. I'll fluff first, moisten, wring it out. Without touching the wound with my sterile gloves, I'm packing the wound loosely with 2 4x4 gauze. Okay, I have the wound measured, cleaned, and packed. Now I'm going to go ahead and put my bandage on my wound. Put the ABD pad. Before I put the ABD pad on, I'm going to lay 2 sterile gauze over the top. Of my wound. 1 and 2. Now with the blue side up, I'm going to put my ABD pad over the wound. Alright. I'm going to go ahead and remove my soiled sterile gloves. And place them in my red biohazard bag. I'm going to go ahead and make a few pieces of tape to tape up. Well, I'm going to wash my hands and then make a few pieces of tape to go around the edges of my wound. You doing alright, sir? Still feeling okay? Okay, great. I'm going to go ahead and begin to place tape around my wound. And I'm going to use a final piece of tape to date, time, and initial this wound. Okay. Place that right there on the corner. Okay, I'm going to go ahead and begin to get rid of my trash here. I'm going to let's see, also going to cover up my patient and the bandage. Alright. In the real world, I would follow hospital protocols as to how to get rid of biohazard material. Alright, now we'll document the drainage on the bandage, which was serous inguinus. It was scant and it had no odor. The wound itself, the bed of it was red, the edges were pink, there were no drains in the wound, and there was no odor, and it appeared to be not to be infected. The patient tolerated the procedure well. Alright, and that is wound care.